Hi, I'm Johnson, and I'm on the spot at the Gardens Hotel where we are going to speak with Craig about some emergency medical technology course that was ongoing, and there are students and well wishers inside the class who are about to experience the
Basically, emergency medical technology is actually the study of pre-hospital emergency medicine that is providing emergency care to individuals either ill or traumatically injured outside the hospital setting, maybe from someone's house or on the road after a motor vehicle accident. The profession itself here on the island is one that is a fairly new one in that it's young to arrive, and we have few qualified persons in this area locally. The EMS or the EMT program basically started here about 5 years ago when the University of the West Indies Mother Campus, Jamaica, agreed to get involved with myself as one of the local training coordinators, where they evaluate, monitor, conduct examination of the program. And as a result, we've had this program ongoing for the last 5 years, and of course today culminates the graduation of sixth class actually, but second graduation term since the program started. As it relates to how those persons that service is utilized here, emergency medical technicians basically find themselves working in any area that's outside the hospital setting. Most times persons associate EMTs with with ambulances, and they think of EMTs as being persons who just pick up a patient at the scene of an incident and transport them to a hospital, more so ambulance attendants. But the area of work is far more extensive than that. It ranges from basic patient assessment to providing advanced trauma care, advanced life support, such as delivery of electric shock to restart the heart. You have IV administration, drug administration, and that's an extensive area. The program in itself is a 240 classroom hour course, but it's spread out over a 1 year period part-time to allow professionals with regular jobs to also do the program if they are so inclined or interested. Once those persons have completed the training, they become more marketable, they're more diverse, and this area would equally benefit institutions such as the hotel sector, the hotel tourism sector. You find a lot of persons can filter into those areas such as safety officers, occupational health and safety agents. Some may go on to become instructors where they return home to provide training in the same area to the local service. A lot of them also can filter into the fire and emergency services. The unfortunate thing is the fire and emergency services system in St. Lucia is not so structured to take those persons on as specialists in their field, as emergency medical technicians, in that if they need to get into the service, they have to enter the service as firefighters, and then they're so deployed to work on board the ambulances. Once these individuals have completed the initial training as emergency medical technicians, they can now move on to doing paramedicine. They can apply to a university abroad where they can do a full paramedic program, which in most places is an associate degree program, and it allows them to attain the last level of emergency medical technicians. And in actual fact, there are 4 of them, 4 very common ones, which is the EMT Basic, which is the foundation program, and which is what we offer here. There's the EMT-B, which is the EMT defibrillator specialist, which is the delivery of electric shock to restart the heart. There's the intermediate level. That level of EMT specializes in IV administration and intubation, which is the process of putting an advanced airway tube down the lungs to assist that individual in breathing. And of course we have the EMT-P, which is the EMT paramedic. And of course at that level, they can provide a much wider range of skills, and that is where most EMT basics, which is the foundation level, try to get to. Once they're through with the 4 levels, or even after the first level, they have the option to go on to maybe doing an associate degree in EMS education, a bachelor's degree, a master's degree, and it is not a profession that most people are aware of. So you find few people decide to embark on that area of training, and it was our intention to change that. So we decided to bring the professions and the area of study to the island, although on a very small scale. But in the recent past, we've noticed they've been a greater demand. And a typical example of that was the work at Crypto 2007, where a large number of persons were trained on the job at the fire department. So as long as we're marketing St. Lucia as a tourism destination, we now have to start thinking health tourism. And in the EMS environment, it is nothing new to the tourism sector, as most visitors to our island are used to a certain standard of pre-hospital emergency care back in their own countries. So when they visit here, if something happens to them, they're expecting, maybe not at the same level, but a standard of pre-hospital emergency care that can manage the situation effectively. And this is what this program is geared towards, providing the opportunities for those persons to access this area of training, thereby allowing them to go on to further advance